Welcome to Where Parents Talk. My name is Lianne Castelino. Our guest today is a dentist who practices functional dentistry using a holistic approach. Her particular areas of expertise include tongue ties and lip ties. Dr. Mandeep Johal is also the owner of Family Dental Centre in Guelph, Ontario, and a mother of two. She joins us today from Guelph. Thank you so much for being here.
Thank you so much for having me, Lorraine.
So one of the things that I found really striking in doing research about you and the type of dentistry that you practice is something that was on your website, which reads, quote, "Whole body wellness begins in the mouth." Could you explain what that means?
Right. Thank you. So the reason I put that on there, because it's not just because of what I do is dentistry and it's the mouth, but there's a link. A lot of people don't think about gut health. Did you know that 50% of the biome from the mouth actually goes to your gut? So there's a systemic link that I feel like as a society that we're forgetting, that we're like, oh, we're going to go to the dentist, just going to get our teeth cleaned, or going to go just get a filling. But we forget to ask the why. Why is this happening in our mouth? So we can see a lot in our mouth. Think about Chinese medicine. They can look at your tongue and tell you right away what's going on systemically. I don't have that training expertise, but I can look at your tongue and take a look at maybe there's acid reflux happening, silent acid reflux happening, the color of your tongue, the color of your gums. If your teeth are breaking down, there's more of a systemic issue that's happening internally that's presenting to the outside world. So the first signs that we usually see are going to be in your mouth. And that usually is a cue for me to say, hey, we need to work with somebody else now. Let's go see a naturopath or go to your family doctor or maybe a specialist. And patients are always surprised by that. They're like, from my mouth, you can see that? I'm like, yeah, it's the window to your whole body.
Absolutely. So much of oral health practices, good hygiene, etc., starts certainly in childhood. What are you seeing in terms of current trends in your practice as it relates to kids, tweens, teens, that you can share with us?
So when I got this question, I was thinking, it's kind of sad because it's the same. It's the same old story. Still increase in cavities, still increase in gum disease, and increase in malocclusion. Malocclusion meaning crowded teeth. And that's really sad to say because with all our technology and advances, especially in medicine that we think about that we're so proud of, but I don't like using the word pandemic, but it is. All these things are still a pandemic. It affects so many children. I just met a dentist that works with public health. And she told me the most disturbing number that I had to share with you right now. She said, Mandeep, dental infections are affecting people so much that if they go to the ER because they can't get in or they can't afford to see their dentist, it costs the government $500 for one dental abscess visit per patient that goes to hospital. Do you know how substantial that is? That's a lot. And that includes children and adults because it's not sometimes feasible or we're not available. But that just still tells you and she gave me a huge number of how much of that money in total that's spent in healthcare goes towards just those dental visits at an ER. So that makes me sad because I'm like, what are we doing as a society? Why is this not preventable? What are we missing? And it ultimately comes down to is what's contributing to these trends is going to be diet. Diet is huge. And that's something that when we talk about whole body wellness, nutrition counseling, supplement counseling, we touch base on that, but we make the right referrals for that because that's the most important thing is the why. Why are you getting cavities? Why do you have gum disease? Why does your child have crowded teeth? We should start asking these questions. And you may be thinking, well, Mandy, what does diet have to do with crowded teeth, malocclusion? Great question. Starting babies with baby-led weaning or hard food is what grows the face, grows the jaws. If our faces can grow, our jaws can grow nice and big, our teeth have lots of space to grow into them. But if our jaws and our faces aren't developing because we're eating soft, pureed food, I just want to pause there and let you know that my kids had pureed food, just so everybody knows, don't feel bad. We have
Mhm.
enough mom guilt as it is, or parent guilt. So
Mhm.
don't worry. I'm just here to educate, not to make anybody feel bad. But I coach parents on both sides. But to go back on track, it's that soft food that's causing these jaws not to grow, because what grows bone is muscle. And if our muscles aren't being trained and strengthening the way they should be, our faces aren't growing. And now we got these crowded teeth. Crowded teeth also lead to more gum disease issues because you can't floss them as well. You can't brush them as well. And then you get cavities because now the teeth are too tight together. So it's diet. I don't want to get down to.
Yeah. Let's talk about some of the root causes of the other key issues that you just mentioned there. Cavities, certainly in this age group, is, as you said, something that you see quite often. When you drill down to the root causes, what's happening there?
So one of the things that happens, because we want to focus on the teens, right, is the biggest thing that's happening for teens and tweens right now is hormonal changes. So the group of people that I usually see in my practice that I've seen them for years, and all of a sudden I'm like, whoa, why do you have so many cavities? It's usually hormonal changes. So for women, when they're menopausal or premenopausal, like anytime there's huge hormonal changes, I'm seeing increase in cavities and increase in gum disease as well.
So, if you're a parent at home with all the different things that you've got to be concerned about as a parent, and you haven't maybe been as vigilant, let's say, about oral health, you've done the best you could with your kids. You get to a point where they're on their own and they have to figure this out in this age group. What can you say to parents to reassure them about and support them in terms of how they can support their own kids to maintain their oral health?
Um, so in our practice, what we do is we rely on a lot of visuals. So what we've lately done is, not lately, I've been doing this for a few years now, is I have a microscope. And what we do is we do a saliva analysis in a phase contrast microscope, and kids or teens are able to see what's in their saliva. And it should just be saliva with a little bit of bacteria, which we all have bacteria, but there's good and bad bacteria. So we break it down for them. And kids are very smart. They have technology at their fingertips. They can look up stuff right away. And they know that if there's something in that microscope slide that they're seeing on this screen, that things are just moving around and spinning, I'm like, that's very destructive. Those bacteria are very destructive. And they're like, oh, that's gross. And I'm like, now imagine if your girlfriend saw this, how would she feel? Right? Or boyfriend, vice versa. So we got to talk to them at their level and show them visual aids of like, this is what's happening. This is what we need to help you with. And unfortunately, we were all at that age. We can never think 10 years from now. Teens are very present in the moment. So we can't be talking to them about the long-term effects of it. That we know gum disease, there's a link to Alzheimer's. We know there's a link to heart problems. We know there's a link to fertility. But they're not really thinking about their long-term, because I always use that with my older patients. Like, I'm worried about the 10 years from you now, or 20 years, where you're going to be. It doesn't apply to teens. So I say keep it visual. Microscope is one idea. The second idea is you can get these little tablets called disclosing tablets. What they do is they'll just chew on them and they will color any plaque that's left on their teeth. So they can just quickly brush that away. Teens don't want more lectures. They just want something quick, easy. What do you do? Get these little disclosing tablets. You can Google them online, get them on Amazon, get them shipped to your house, and tell the child, go chew on this. And after you're done brushing your teeth, did you do a good job? If not, now chew on the tablet, go brush your teeth and get those stains off. So
Certainly, something else affecting this age group in particular, and it's a global epidemic, has to do with anxiety and stress. How did those factors impact oral health?
okay. So lately, that's another thing I've been really seeing is I didn't bring this up in your first question because people don't think it's really dentistry related, but it is. We, at my clinic, we address how a child sleeps. We address their posture. We address how they're breathing. And believe it or not, these kids that are presenting with anxiety or have a lot of stress, they're grinding their teeth. They exhibit a lot of stress, anxiety symptoms that we're already aware of, but they're all shallow breathers, And I say, hey, can we breathe through the nose? They're like, yeah, I can breathe through my nose. They have no problem. But then as soon as I sit down to them, sit up, and we start talking like eye to eye level, they're like shallow breathing, like right here. I'm like, I shouldn't be able to hear your breathing, right? Let's start practicing breathing through the nose and not the mouth. So majority of them have open mouth posture, meaning they're not walking around with their mouth wide open, but they are seeping air through the lips. And that leads to shallow breathing. Shallow breathing feeds into your anxiety. And shallow breathing, mouth breathing, also feeds into what's called the sympathetic system. Remember, fight or flight? It's a very stressful state. And we were never designed to breathe like that unless we were literally running from something. Like we were in a real dire, stressful situation. But if kids are mouth breathing constantly, their brain is thinking that they're in a dire, stressful situation all the time. So mouth breathing changes the chemistry of the brain. And now this is also affecting their quality of sleep. Now, if their quality of sleep is affected, that affects you the next day, right? As adults, children, teens, babies. So we address all these things. So I'm seeing an increase now. Why? Is it because the pandemic? Was it COVID? We were home for a long time, definitely. We're on the screens more. We're not seeing people. We're not connecting as much, right? School has been stressful. I just feel like everybody's stress levels have just been elevated all around the world. And I feel like that energy really affects everybody. And this poor teen age group has been really immensely been affected. So we coach them on breathing as much as we can to help them with anxiety. Because if you can sleep at night with your mouth closed 100% of the time, you've just put yourself into a parasympathetic state. It's relaxation. You're releasing nitric oxide. And it just does all these amazing things to calm the brain and help fight cavities and oral health too, right? Because mouth breathing changes the biome in the mouth. It makes your mouth dry. So I'll ask patients questions. Do you wake up with a dry mouth? They're like, all the time. I'm like, well, that's not normal. Because now you create this dry environment. Now you got gum disease, you got cavities. So sorry, that's a long answer to your question, but I just want to show you how it's all connected.
Absolutely. And I'm curious, when you paint that picture for your young patients or even your older patients, what is generally the reaction that you get? Because again, I don't think the average person thinks about their mouth and what's going on there as sort of the epicenter of, what could go on elsewhere in the body.
Wow. That's a great question, Lorraine. Again, relatability to this group is really important. And I know I'm not cool, but you just got to see, like, what are they into? What are they watching? And one of the things that came up, and it was by accident, was I was telling this parent that their teenage daughter was a mouth breather. And they just started laughing. And I'm like, I'm so sorry. Did I say something? What's so funny? They're like, Dr. Johal, have you ever Googled under Urban Dictionary mouth breather? And I'm Googling it. It says stupid person. And I'm like, I felt so bad. I'm like, oh my God, I just called this guy's daughter stupid. That's the Urban Dictionary. And I felt so bad. So then they elaborated more. There's a show that a lot of them are watching called Stranger Things. And in Stranger Things, mouth breather is considered a bad word. Like that is an insult. And I was like, ooh, this could be good. This is something I can relate to everybody. So when these teenagers come in, I gotta be very careful. If not, my objective isn't to put them down, is to say, you guys watch the show. Yeah, I did watch it. And you remember that episode about the mouth breather? Like, oh yeah. I'm like, well, sweetheart, then I elaborate a little bit about mouth breathing. I'm like, you're not walking around with the mouth wide open, but you are seeping air through the mouth. And that is going to change the way you look. And that's where it gets them. What do you mean it's going to change the way I look? I'm like, yes, it's going to change the way you look. It's going to change the shape of your face. It's going to change the way you breathe. It's going to change everything. And your head's going to start coming like this. So why don't we just help you by just getting that mouth closed during the day? And then we can breathe through the nose day and night. And they resonate with that. They're not going to, unfortunately, these teenagers are not paying for cavities. They're not paying out of pocket. So they don't realize how valuable it is, the information we're giving them to prevent gum disease and cavities. So we need to relate to them in a superficial world and relate to them from TV shows that they watch.
Certainly, whatever it takes to get the message home. Can you paint a picture for us, Dr. Johal, of the consequences of neglected oral health or poor oral health in the younger years, in the tween years, in the teen years, on later life as adults?
Mm-hmm. So I had a patient who told me he was at a conference, at a geriatric conference. And the head of the opening statement, the gentleman giving the open statement, said his geriatric patient says two things to him, that what they wish they would have done when they were younger. One, take care of their teeth. Two, take care of their feet. And the reason taking care of their teeth is not just to have perfect straight teeth. The detrimental effects of neglect when you're young, the effects it has long term is missing teeth. Is very expensive to replace. Missing teeth and having gaps in your teeth, it's not just gaps in your teeth. It actually affects your posture. It affects the alignment of your jaw, right? Think about when we see older patients that have dentures and the face starts to shrink in a little bit and their lower third of the face gets smaller. And we always visual, or if you were to ask your child right now and say, let's play grandma and grandpa, they will pretend they have a cane and they lean forward, right? You always see that forward head posture and they lean forward because that's the misconception that we have what aging is supposed to look like. But that has a lot to do with posture and obviously muscle tone. So if you're losing teeth, it has a detrimental effect on your whole posture, head to toe. I do that every day in my practice. I help people line their jaws better to give them more strength so they can sit at a chair all day if they need to, or drive, or work out, whatever they need. And the other detrimental effects of neglecting your healthcare right now is long-term effects on fertility. There's a link between gum disease and Alzheimer's. There's a link between heart disease, diabetes. I mean, the list goes on. There's such a systemic impact of it. But again, as a society, we're just obsessed with straight, beautiful teeth, right? And that's what I'm trying to get away from. And the last thing I get to mention, which I wish we had more time to talk about, is sleep disordered breathing. And I'm noticing more and more that patients that have sleep apnea aren't fitting that typical mold that, we were taught in school, overweight and old. It's actually skinny. That's it. I don't see anything else. It's skinny, protruded jaws are back, no more overweightness. So, and I'm seeing sleep apnea in patients younger and younger. I just saw a 20-year-old the other week, 20-year-old with sleep apnea. And I said to him, I go, what do you think is going to happen? What's going to happen 10 years from now? He's like, nothing. I will just crank up the dial on my sleep app machine and go, what happens later when you're like 80 or 70 even? He's like, I'll just get another machine. I'm like, that's not how it works. So it has a detrimental effect on sleep as well.
When you talk about sleep apnea just for a moment, what is contributing to that in younger ages, in your view?
So when I talk about sleep apnea with my patients, we talk about three things always. One, structure. Structure meaning the jaws are getting smaller. And when you mean jaws, you have to think about your upper jaw is the floor of your nasal cavity, right? So if your upper jaw, it never grew the way it was supposed to grow, that means the inside of your nose is very narrow and small. Think deviated septums, right? Deviated septums, everything's just congested, you get deviated septum. But think about also the pipe at the back that you breathe through, your airway on the back of the throat. That's also structurally very small for them. Could be soft tissues in there, meaning your soft palate, or your tongue. The tongue is in the airway, right? But tongue ties into my second thing, which is function. Is your tongue functioning the way it should be? Is your soft palate functioning the way it should be? Do you have nasal collapse? Are you getting collapsibility somewhere in your airway? So then we start addressing function. How do we help with that? There's ways we can do that. The third thing I address when we look at sleep is metabolic. What's your gut health like? There's a huge link between your gut health and how you sleep. So, and that can happen in any age. I see sleep apnea in children. Right? Snoring is not normal. Snoring is common, but it's not normal. Like I say this every day, in childhood, snoring is the early smoke signs of the sleep apnea fire sign that you need sleep apnea as a fire. The smoke starts way earlier. So if teenagers are sleeping with their mouth wide open, or snoring or children, it's the early signs of sleep apnea.
And what can be done if that is the case? And that is what has been diagnosed and detected.
Yeah. So again, dressing those three things. So structure is what I can help with, and function. So those are the two things I'm going to help with. Structure, meaning I use, I could give devices that are quick and easy, like call a sleep appliance, where you put in the mouth, moves the jaw forward, and that can help you with the sleep. But again, that's a Band-Aid. That's not a fix, right? So if you're in your 20s and you have sleep apnea, or in your 30s and 40s, you want to find a solution. How do I help my sleep apnea? What can I do to improve it, or to help sleep better? I do expansion. I do different types of orthodontic treatment that really opens up the airway laterally and forward and gets all pipes nice and wide and open. And then functionally, if you were to Google sleep apnea, you always see a gentleman laying on their back and the tongue flopping in the back of the throat. Well, when I address function, I'm toning that tongue. I'm getting that tongue out of the airway, up and lifted, and you're sleeping a lot better. So toning the muscles of the airway is the functional part. Doing that, we've gotten even 50, 60-year-olds out of sleep apnea machines. I'm just not as quick as you to like do everything and post stuff on media, which I want to get better at. But I have testimonials that I'm trying to get from patients that are like, oh my God, I don't need my sleep app machine anymore. I thought I was stuck with it for life.
So, Dr. Johal, what can you say to parents to help them better encourage oral health vigilance among their children? And certainly when you get into the young adolescent age, they're on their own. You're hoping that you laid the foundation. You're hoping that they listen to you. But how can you support parents in helping them support their children?
That's a really good question. Like we talked about the visual aid, but maybe just giving them easier tools. So like they're not going to floss if we haven't encouraged them to floss from an earlier age, like made it a habit. It's going to be really hard to get into their teenage years. So maybe give them a water pick. Water picks are easy to use. We got to think about what's easy, convenient. Get it out of the box, set it up for them, and let them use it. Unfortunately, we should do these things. I know we're babying them, but dental care is very expensive. And these kids, unfortunately, aren't going to really realize that until they're literally on their own and had to pay out of pocket. And that could take some time for them to figure out. So water pick is a great idea, very easy to use. It's like I always say it's like a water gun for your teeth. And electric toothbrushes, right? Electric toothbrushes are great. Christmas around the corner. So anything we can do to make their lives easier and give them visual aids. And I think really that's it. Just hopefully we did our best raising them when they were younger and they're on their own.
Now, in your case, as a dentist, you also have two children who are 9 and 7 years old. What does this oral health regimen look like in your home? Is it easier or more challenging given your professional status?
Oh my God, that's such a good question. Full disclosure, there are some nights they don't brush their teeth, and I hope they're watching. They watch this, and I'm like, yes, I'm going to tell the whole world. Life happens, right? So, but on a typical night, we do our whole nighttime routine is nasal rinses. That's part of my oral care because head and neck. So we do nasal rinses, nasal irrigation. And then we got floss sticks. So they're easy for them to use. They're not going to play around with the floss because that's a hazard actually with little kids. They're very imaginative kids, two boys. And then brushing their teeth. So I always let them brush their teeth first. I don't care how old my kid gets. If they're living under my roof, I want to be able to make sure that I'm brushing the adult teeth, especially at the back, the ones that they're missing, and by the gum line. And because I tell them, I go, Mommy doesn't have time to do your fillings. Mommy doesn't have time to do these things. So either we do it just tonight quickly for 2 seconds, or then you got to come to my work and know how to make time for it. It's going to take away from a nice weekend. I don't want to have to do that. So we try to make it fun as much as we can. But as you know, as any parent, nighttime can get pretty crazy. You want to get them to bed on a certain time. You want to make sure they get enough sleep. But all we can do as parents is just do our best. Like I said, some nights they don't. And I'm not going to sweat about it. I'm going to make sure that after they're done eating breakfast in the morning, that their teeth are nice and brushed before they go to school.
Baby steps, in other words.
Exactly.
Let's talk about, you've mentioned some of the potential long-term effects of poor oral health, but let's talk about some of the more, major illnesses and conditions that can arise if you have neglected, your oral health. Could you take us through some of those to keep in mind?
Other things that can happen with neglect is like gum disease, infections in the mouth, like abscesses from neglecting over long term. The other thing we didn't talk about too is the implications of wisdom teeth too, right? That's a common thing that's affecting teens. I know we just went off a little off topic from your question, but that's something we should be addressing as well because it's becoming very common is for teens to have their wisdom teeth removed by the age 16, maybe 17. And now I'm getting it even removed earlier because kids are just developing so much quicker. They're losing their teeth a lot quicker. But poor oral health, I find, leads to infection in those wisdom teeth areas for the kids that don't get their wisdom teeth taken out.
So, Dr. Johal, if you were going to sort of summarize, at the beginning, you talked about, being heartbroken by what you're seeing among your patients. But if you were to sort of summarize what concerns you most and what can be done about it, how would you respond?
I would say, as a parent myself, we need to really understand the whys. Like, we can't just think like it's okay, it's just a cavity for my child, it's not a big deal, because that's just the one cavity and I get it. But now they're getting multiple cavities, or they have chapped lips, or they're snoring at nighttime. Always ask the why is this happening. Don't just say, I'm going to get a pill for it, I'm going to take care of it. I address parents even with ADHD symptoms, the kids that have ADHD, and it always comes down to sleep, actually, in 80 to 90% cases. So I'd say please ask the why and focus on diet, making sure we're staying away from processed food like crackers and goldfish. Processed food is very detrimental for our kids. It's readily available everywhere. So teaching our kids healthy eating habits from the start, and obviously having good oral health care, brushing and flossing. But full disclosure, I will tell you guys this, and you may hate me for this, is there are some kids that don't brush or floss their teeth and they have no cavities. I want people to remember that because they have probably good oral health, like gut health and good genes, but they're also probably eating really well, right? And if they are eating well and they're still getting that breakdown, then I want you to look at one step further. Why is this still happening to my child? Is it stress? Is it metabolic? It's always ask the why. And I know this isn't really the oral summary that we're looking for, oral health summary, but the way I approach in my practice as a whole body wellness is please look from the inside of what's happening. Why is it presenting to the outside world with gum disease or cavities? What's going on the inside that's causing it? It's not what's on the outside that's causing the inside. It's the other way around. So always ask the why, and don't let another professional just say, it's okay, it's just the way it's supposed to be. That's not okay. I didn't want to settle that. I didn't want to settle for that in my personal journey, because that's how I got into whole body wellness. When somebody told me my son had crowded teeth, Mandeep, don't worry about it. We'll put braces on him when he's later. Why is braces a passage of right? It shouldn't be, right? So I asked the why. And that's where I got into the whole body wellness. I got into the whole sleep part of it. So please, as parents, always ask the why. And I'm here to help. If anybody has any questions or wants to reach out to me, I have lots of information on my Instagram page for parents at Dr. Mandeep Johal. I'd love to help anybody that's looking for any answers.
Certainly lots of food for thought. Thank you so much, Dr. Mandeep Johal, dentist and owner of Family Dental Centre in Guelph, Ontario. We really appreciate your time and your insight today.
Thank you so much for having me. I hope it was helpful.